So now Julia Zell, OSDH General Counsel, will present the proposed emergency rules for consideration. Julie.
Just going to do for the board and the public a quick summary of the rules that were posted on the Oklahoma Medical Marijuana Authority website. These are proposed rules that we are presenting to the board for their consideration and possible approval. State Question 788 initially provides for a patient license for medical marijuana. It allows both minors and adults to get a patient license. Minors can get a license if there are 2 board-certified physicians that sign off on that license and they agree on the condition for the child. Adults, it only requires 1 physician, and the physician's standard is in their best medical judgment whether or not the patient will receive medical benefit or palliative care benefits from the recommendation of medical marijuana. We've also, part of that physician recommendation requires the physician to review the PMP to screen patients for substance abuse, mental illness, and whether or not they pose a risk of diversion of the marijuana. It also requires the physician to follow up with that patient at least annually to make sure that that recommendation for medical marijuana is still medically appropriate. There is also in State Question 788 provision for a caregiver's license so that if the patient is unable to ambulate or otherwise go to the dispensary, that a caregiver's license can be issued on their behalf so that this caregiver can go to the dispensary, get the medical marijuana, and then administer to the patient. Each patient can have 1 caregiver, except for minor children, they can have 2. There's also provision in the state question for a temporary license. If you have a medical marijuana card from out of state and you come to Oklahoma with additional application and documentation, you can get a 30-day temporary medical marijuana card here. Part of the patient license, as written in the state question, allows patients to home grow certain amounts of their own medical marijuana. The proposed rules have restrictions in there stating that you can't view the marijuana if it's homegrown from a street, has to be behind a 6-foot fence under lock and key. Next slide. The next part I'm going to talk about is commercial establishments. We have set up kind of standard initial regulation for all commercial establishments. And what we mean by commercial establishments is the dispensaries, the processors, and the growers. All of those licenses per the state question are $2,500, and anybody applying for one of those licenses cannot have a felony within the last 5 years. So generally, we have requirements for all of those commercial establishments, speaking to physical requirements like fire suppression, alarm systems, video surveillance, qualifications and background checks of employees that might be employed at those commercial establishments. The rules also say that the commercial establishments cannot be co-located with another business. And what that defined in the rules means that somebody can own a processor, a grower, and a dispensary, but you can't have a dispensary and a McDonald's together. So we also have advertising restrictions related to the dispensaries and require all commercial establishments to post a $100,000 surety bond. As to the dispensaries, we have specific provisions in there. One of the strongest one is provision for a dispensary manager. This person is going to be responsible for the actual dispensing of the medical marijuana, tracking it, safety standards, inventory standards, reporting standards, somewhat like you would see with a regular pharmacist, but not with the same qualifications, but to ensure the integrity of the product and how it's dispensed. With dispensaries, we've limited their hours to Monday through Friday, 8 a.m. to 12 a.m. Processors, this is where the marijuana is going to come from the grower, and it's going to be processed into concentrates and other forms. We have stringent processing standards. They're required to do a lot of the extractions in a separate room under what's called a closed system or under a hood. Growers are limited to growing marijuana indoors. That's for a few reasons. That's to ensure the safety, security of the marijuana, but also related to pesticides and water runoff and other issues like that. State question also provides for a transportation license. We've tied the transportation license to the commercial establishment license. When people apply for a commercial establishment license, they can also apply for a transportation license, and any of those can be issued to any employee that will be transporting the medical marijuana. We have strict standards on how that marijuana can be transported, you know, safely, type of vehicle, things like that. Next slide. We've instituted provisions related to laboratories that will be testing the medical marijuana, and the provisions provide, they won't only be testing THC content, but also for pesticides, heavy metals, other types of toxins that, you know, could compromise safety, and that testing data will flow through and be tracked with the marijuana as it's dispensed, so that if there is a problem or a health issue, that we can then pull that laboratory testing data and take it right to the marijuana to figure out what the issue is. There's also provisions that if it tests under or over in certain areas, that it cannot be dispensed. We also have provisions related to packaging. Has to have THC levels. We've come up with a sign that indicates that, you know, this product contains medical marijuana. There's also some cautions and restrictions. All medical marijuana has to be dispensed in a child-proof container and has to have strict labeling requirements. The THC levels have been set out in the rules. A single serving per our rules is limited to 10 milligrams. Products or concentrates are limited to not more than 12% THC, and mature plants not 20%. This was an item that we received a lot of public comment and input on. The Oklahoma Hospital Association and other medical groups supported the recommendation that with the numbers that we came down on, and these numbers that we came down on were based upon our review of scientific literature and also what other medical marijuana states are doing. Prohibited products, we have put provisions in here that limit products that dispensaries can sell that might be appealing to children. So gummy bears or candies that look like dogs or anything that might attract or draw a child's attention, we've prohibited those because we obviously don't want those to fall into the hands of a child. Next slide. We've put provisions in the rules that tie smokeable medical marijuana to the Smoking in Public Places and Indoor Workplaces Act, stating that if you're going to smoke marijuana, you can only legally smoke it in the same places that you can currently smoke tobacco. Just some additional things that we've put in the rules are strict inventory and tracking requirements. From grower to dispenser, we want to be able to track marijuana for diversion and to see, you know, to ensure that it's going through the process, or if something's failed safety testings, there's provisions for how that is disposed of, and so we should be able to track that and have all of that reported to us, as well at the dispensary level at the required 7% tax. State question also provides for a verification system. The purpose of this is twofold. If a patient goes to a dispensary, that verification system allows the dispensary to determine if the patient's license is valid. They have to present the patient license and another form of ID. But it's also going to be available to our law enforcement partners, so that if they pull somebody over and they have marijuana on them and do not have a patient license, they can try to verify through the system whether or not they're a valid license holder, and if not, take the appropriate action. One other provision of the state question was a research license, and we've added strict regulations in here to make this a true scientific research license. And we require inspections of the laboratory for them to line out the scientific process that they're going to, the goals of the research, report back to us, and we're also able to inspect and check in on the results of that study, as well as the amounts of marijuana that have been consumed, to ensure that it truly is a scientific research process. That's the end of my summary of the rules. I'm happy if any questions or discussions from the board members.
Julie, I commend you and the commissioner and the staff for a very comprehensive review from various angles and coming up with a very, very good product.
Thank you.
We commend you, honestly.
Board members, questions?
Julie, can you tell us, how long this process took you and who, in development of this,
Of the rules.
the development of the rules, who you worked with in the development of the rules, since this is new to Oklahoma?
Yeah, and we probably starting back in April got the board's approval to begin preparation for this if this were to pass. And internally, we put together several work groups, one related to licensure, one related to rules. And so the rules group not only worked internally, but we reached out to many, not only other state agency partners like Department of Mental Health, Department of Pharmacy, OB&DD, Agriculture, Tax Commission, but also have had numerous meetings and input from all types of, medical associations, trade groups, pro-788 groups, anti-788 groups. So we've really tried to hear everybody's side on this, take all of that into account, but also at the same time doing our own research on other states who had medical marijuana programs, what those look like, what the rules look like. So as best we could, we tried to take a very comprehensive approach to this and hear all input from all sides.
And how many public comments did we have?
I believe it was over 900.
I actually think it was over 1,000, Julie. Lose count.
So after the public comments, were there any changes that you looked at after you looked at all the public comments together, that things you hadn't thought of in 3 months of?
Yes, there was two things that I can think of off the top of my head. One of them was related to the inventory tracking. We put in much more specific language requiring the commercial establishments to track inventory, but also processing standards. Doing our research, there are some methods that are inherently dangerous, and just good kind of guidelines to put in place for how you extract and process medical marijuana. And so those are two things I can think of right off the top of my head that we put in there to tighten those processes up.
Julie, one of the things I do know about regulatory departments is that we have one guideline that we can't go beyond, and that is arbitrary and capricious. And I had an opportunity to sit down and go through both the 788 and your regulations. And you covered everything, and there's nothing in here that I can see that could be even thought of as being arbitrary or capricious. So you've done a good job.
Thank you.
The second thing I want to make a question about is, you mentioned other states. I know there are several states that already have medical marijuana, and I know you must have looked at them to see what they have been doing. Is there anything that other states have done that you were able to build on for Oklahoma?
Boy, there was a lot. Like the transportation standards of other states, we were able to, I want to say that we took a lot of that language from Arizona. The state question for Oklahoma is written a little uniquely related to the physician standard and how that works. And so we really, with our interagency partners and medical partners, kind of had to draft that ourselves. But certainly commercial establishment safety, video surveillance, fire suppression, things like that. The testing that's done at the laboratory, we had great input from other states on that. And I personally feel that the testing standards that we have proposed here in Oklahoma are some of the stringent nationwide.
Thank you.
Julie, there were some issues, I think, through the public comment and other sources that weren't able to be addressed in these rules. Things that maybe we don't have the power or the authority to address. Do we have a list of those available? Are they something that we could turn over to someone who does have the authority?
Yes, we've been keeping a comprehensive list of things that we think that the legislature might want to consider in clarifying or helping expand on 788, and we've kept that list internally and continued to develop it so that, when the legislature next comes into session, that we can visit with them about that.
Thank you. So board members, our task by the board is to protect the health of Oklahoma. Anyone have comments to that effect about maybe some things that you're concerned about these rules, or things that we feel that we weren't able to go far enough and there might be some danger to the public?
Julie, were there some medical associations that wanted to have a pharmacist on site at the dispensaries, and that's not currently in the regulations as it's proposed now, correct?
Yeah, not only other medical associations, but other agency partners. And as we looked at that, I did not feel like we could get there under the law, but what we did do was this dispensary manager. And I worked with the Board of Pharmacy on that language, talking about what that person would do. Every dispensary would be required to have one, and that person, would be identified when they apply, and they'd have very strict duties and guidelines that they would have to implement, as well as policies, supervision of employees, patient education, and things like that.
So you feel that us regulating that a pharmacist would have to be on site would be outside of our legal scope to be able to regulate
I do.
with this?
Yes.
Understood.
So that's one of the items on the list to go to the legislature next spring?
Yes, it is.
Okay.
Mr. President, I think one of the other issues that concerns me is when you look at just the last 10 years here in Oklahoma, we've taken very concerted efforts to reduce the prevalence of smoking in our state, and we're about to take an action that's going to increase it. And that's bothersome. And it's also bothersome to me that under the rules, an individual, even though they will not be able to smoke where it's not permitted now, can still smoke marijuana in publicly traveled places. So I don't think we're protecting the public that doesn't smoke. In fact, I think we're imposing a hazard on them.
We looked a long time internally at the smoking issue, and I would say two things. I think that there's provisions that allow home grow, and so patients can have live plants, and so I think the implication there is that they can smoke it or do whatever they want with it. Also, I would say that I think most voters, when they went to the ballot box and voted for this, assumed that this would be smokable marijuana, just kind of a common sense approach. I know that there's thought about recommending physician standards, and a physician would never recommend a product that had to be smoked. That provision's kind of interesting because there's case law, federal case law, that says physicians can't actually prescribe marijuana because it jeopardizes their DEA license. They can only make a recommendation, and the recommendation has to be for medical marijuana generally, not for specific types. And so that is why the rules are written as they currently are. We've tied it to the, Oklahoma Smoking Indoor Workplaces Act. I can't remember the name exactly, to try to limit that. But I think that that is something that certainly, as the Board of Health, is within your authority to go a different direction if that's what you choose to do.
Dr. Graham?
We were looking at other states that had medical marijuana. Were they reporting into their PMPs the use of marijuana?
Some of them do, and in Oklahoma, we can't do that here absent a change in statute. But what we can do is require doctors to check the PMP. And so that's why the rules are written the way they are. But to have marijuana reported to the PMP would require statutory change.
As it pertains to the dispensary manager, currently our controlled substances and any prescription written by a physician is dispensed by a pharmacist that's board certified. I have yet to see you distinguish the difference in the fact that this is a medical marijuana that is prescribed by a physician that is a controlled substance. And so why a pharmacist would not be in the interest of patient safety.
Well, keep in mind that this is a recommendation for medical marijuana. It's not a prescription, so it's a little bit different there. There's also issues related to the scope of practice of a pharmacist, but also in the state question, it sets out a commercial license requirement, and to add an additional licensed occupation onto that commercial license is a large step for the law. I think that absolutely it can be done by statute, and I think that's a really good recommendation. I just legally have concerns whether or not we can do that by rule.
Okay, thank you.
Again, is that in one of the issues?
Yes,
to be
it
addressed by
is.
the legislature in the
Yes.
spring?
Yes.
I think one of the challenges we have is, on one hand, we want to implement the law and the will of the people, but we need to do that in a safe and effective manner. So it is a problem to have a Schedule I drugs being recommended, prescribed by a doctor, board licensed, board certified doctor, and not be filled in by a pharmacist who is an expert on chemicals and medication and interactions. And many of the marijuana products have number of interactions, a number of medications, like common medication, fluvoxamine. Significant level changes happen in some of the medications. So to protect the health of the Oklahomans, I highly recommend that we have a pharmacist involved. Otherwise, it is a Schedule I recommendation, prescription. And the dispensary manager, what is their training in pharmaceuticals, in brain chemistry, in interactions? Have we defined that? So I really would like us to look into that, Julie.
Any other discussion? Any motions?
Mr. President, would you entertain a motion?
Absolutely.
I would submit, I think that from the vote on 788, there are only two undisputable facts. The will of people in Oklahoma is that we have access to medical marijuana and that we do it in a timely manner. And what these people, Commissioner Bates and Julie and the rest of the staff, have done in preparing these rules in a tremendously short period of time to meet the statutory guidelines is tremendous. And for us to delay passing a set of rules passed today, I think would do them an extreme injustice. So at the same time, our first and foremost obligation is to protect the safety of the public in this state. So my motion, Mr. President, would be to approve the rules as submitted, with exception to 681-2-11 that we would take up under a separate discussion.
We have a motion. Do I hear a second?
I'll second that.
Dr. Gayko. Further discussion?
Can we make a motion to amend with the pharmacist on site as well? Later, we're making a motion to amend smokeless forms of medical marijuana being dispensed.
As far as rules of order, I think Chuck could amend his motion if he would do that, to include a different exclusion of these rules. So we could exclude two things from the rules and then look at both as a separate matter.
I'd be willing to do that. But I think the items need to be addressed separately. Does that make sense?
Yes. Mr. Chairman?
Yes, sir.
There are some issues that need clarification, may not need amendments. For example, the hospital systems, we have great hospital systems in Oklahoma. They don't have any clarity whether an employed physician can prescribe or recommend marijuana products to their employees. Some of the large systems have 10,000 employees, 5,000 employees, 20,000 employees, and some of them are patients of these doctors. So we need some clarification for the hospital systems. And we also need clarifications whether a physician that wants to prescribe marijuana products in a hospital setting, what is the role of the federal government law that about marijuana? The hospitals depend on federal licensing as well as state licensing, and their reimbursement ability to treat people, elderly people, Medicare people, Medicaid patients, depends on the ability to have a license. So we don't want them to be put in a situation of confusion. So I would like to see that we make some clarifications today, whether through an amendment or through, defining the real language, whatever, procedure we take. And I don't know, Chuck, if you want to add that as an amendment or
Dr. Christian, if I could say something.
Sure.
We aren't going to be issuing the initial licenses until the end of August. And so we could work internally to refine that rule language and bring it back to you next month, because it isn't going to be anything that's going to be implemented prior to the end of August. So we can have some time to be thoughtful with that language and bring it back to this board next month on those two issues.
More feedback from the
Sure.
hospital systems and the physician groups about those issues of federal versus state and from the legal system to clarify so that we deliver them in a safe product.
Absolutely.
Thank you.
We'll do that.
Thank you, Dr. Krishna. What I hear right now is an amended motion by Chuck Skillings to include two sections of the law. The first one was named in his motion. The second section, Dr. Gerard, do you have the numbers, the titles off of that?
It's 68128.
68128. Let Julie look for that and confirm it for us if you don't mind.
Thanks.
Just for clarification, did you say 681-2-8?
I think that it deals with dispensaries.
At least in the copy that I have, there's a 2-7 and a 2-9, there's no 2-8.
I believe it's 681-1-4 under definitions.
681-1-4.
Page 2.
The regulations that I read had 61-2-8 had to do with dispensaries. 2-9 is disposal, and 2-11 is restrictions on smoking. So there should be a 2-8 in there somewhere. I don't have a copy of that with me.
When I look at it, I see a 2-7 and then I see a 2-9. I don't see anything more. Maybe I'm looking wrong.
Yeah, in fact, it's what I have in the book. It's missing a 2-8, but I pulled off what we were dealing with. There was a 2-8.
And I don't see it in either the copy I've got or the handout.
That section is not in the materials, is it?
Yeah, 2-8 is not present.
Yeah, I did a spreadsheet and compared the regs that you all had forwarded to us to 788, and that's what I have in my notes. That's where dispensaries were. Addressed. We had so many of these flying around.
Whenever you're ready, you should probably restate your motion.
I have to restate it.
Just for clarity, please.
So my motion is to approve the rules as presented with exception to section 681-2-11, which we've taken up under separate discussion. And then, I'm not quoting the section.
Julie, do we have the number that
Is there a number? That's the definition.
It's under definition.
681-1-4, definition of dispensary
The
manager.
provisions for the dispensary manager.
Yes.
Okay. It is, that rule is 681-5-14.
Let the motion stand as done.
Okay, Dr. Legayko, will you second the amended motion?
Yes.
Now I need discussion.
In the sake of completeness, not to belabor this, I also understand that the medical associations had a concern about the number of dispensaries. Do we have any regulations with regards to the number of dispensaries? I realize that's a topic of discussion, and 50 was the number that was given.
We have had those discussions, and I've done that legal research, and it's my legal opinion that that limitation can only be accomplished by statute, that we cannot accomplish it by rule.
I might add that I reviewed several states, and one of them was Arizona. Arizona has 7 million people, about twice the size of the state of Oklahoma. 2% of the people there, a little over 2%, are medical marijuana users, about 160,000. And they have 130 dispensaries. So, and it's probably, they've had this going for a while, so it's probably based on economics. And as a result, just extrapolate to Oklahoma, there's probably going to be 70,000 medical marijuana licenses issued in Oklahoma. And I would venture to say 70, 80 pharmacies. I know where the area I represent is probably 7 counties. And we don't have enough people, probably we'd be lucky to support 1 pharmacy. Oklahoma City and Tulsa are different, and Muskogee, and where the people all live, but where I live, they'll be lucky to have 1 dispensary to serve all 5 counties. I don't think it should be based on economics.
Other discussion?
Also, Canada has had extensive experience with medical marijuana over the years, and their documents speak to significant increase in crime surrounding these dispensaries. Property crimes, violent crimes, largely due to the cash on hand that's accumulated at these dispensaries, and the inability of these dispensaries, the proprietors of these dispensaries, to actually deposit the cash, transfer the cash into accounts. And so I think there's a matter of patient safety as a result of these dispensaries, and I would imagine that we would not want more dispensaries than we need, and I believe that the dispensary industry also is supportive of that with regard to not saturating the state with hundreds of dispensaries, which would be counter to their own interests. So from the matter of public safety and the necessity for increased security, and I'm sure the locations of these in the various communities across the state would be concerned about the number that could pop up.
Thank you. So I believe our general counsel told us we don't have the authority to limit the number of dispensaries. I think these rules could be amended later, correct, by us, or this issue could be taken up by the legislature as well. Other discussion?
Mr. President, I call the question.
Roll call, Diane.
Dr. Alexopoulos?
Aye.
Dr. Gerard?
Aye.
Dr. Graham?
Aye.
Dr. Krishna?
Aye.
Dr. Legego?
Aye.
Mr. Osterhout?
Aye.
Mrs. Payton? Aye. Mr. Skillings?
Aye.
Mr. Starkey?
Aye.
Passes.
So the next issue is the sections that we excluded. So the first being related to smokable forms. That was 681-1-4, excuse me, 681-1-4. Any discussion about that or motions?
Mr. President, I didn't provide a motion.
I have a correction. That's dispensary manager definition. It's 681-2-11 we're discussing.
Excellent, you're right. 681-2-11 deals with smokable marijuana products.
So I moved to amend 681-2-11, the proposed rules, with the language that you have before you. I don't know if the audience has that language or not. Do I need to read it, or Julie, or?
Yes, I believe.
Adding paragraph C, starting with medical marijuana products may only be dispensed to a patient or caregiver in the following forms. 1, pill. 2, oil. 3, topical forms including gels, creams, or ointments. 4, a form medically appropriate for administration by vaporization or nebulization, excluding flower, dry leaf, or plant form. Tincture, or number 5, tincture. Number 6, liquid. And then subparagraph D, medical marijuana product may not be dispensed to a patient or a caregiver in a flower, dry leaf, or plant form.
Second.
Dr. Alexopoulos, second. Discussion? Dr. Graham?
You know, I've been a strong opponent of smoking while I've been on this board. Strong proponent for smoking cessation programs, both at the state level and within our own health system. But I tend to agree with Julie when I read this law that it implies that smoking marijuana is appropriate, you know. And I lay that out there.
I also have a problem with that. I think in public places, that's what I have a concern about our rules, is that I don't believe in public places, but you know, the voters passed that homegrown marijuana, and if they don't grow it themselves, then they're really taking out that aspect. Yes, I worry about all public places, not just smoking areas, but all public places. And in looking at other laws in other states with even recreational marijuana, they outlaw it in public places. So I like the stricter law as far as the smokable form, but to me, I have a problem with all smokable forms of not allowing that. According to what I read as the state question, which our voters, you know, almost over 50% said they want it.
Additional discussion, Dr. Graham?
You know, I'm not sure quite how the board's going to deal with the open policy issues that the department has been maintaining, and we've heard a few of them mentioned here today. Perhaps at our August meeting, or you know, even later throughout the course of the next 6 months or year as we grow into this. The State Board of Health may want to isolate, you know, a certain number of the things that we feel are most important that need to be addressed with amendments to the law, as opposed to things that we may not be able to pass in rules. Just put that on the table for future thought at an upcoming meeting.
Do you have a motion and a second? Any other discussion? We need to have a vote.
And what is the vote for?
The vote is to adopt additional language in section 681 2-11 that Chuck read. Go ahead, Diane.
Dr. Alexopoulos?
Aye.
Dr. Gerard?
Aye.
Dr. Graham?
Nay.
Dr. Krishnan?
Aye.
Dr. Legeko?
Nay.
Mr. Osterhout?
Nay.
Mrs. Payton? Nay. Mr. Skillings?
Aye.
Mr. Starkey?
Aye.
Motion passes.
Do you have another section or two that we left out of the original rules dealing with the pharmacist at dispensaries? Do we want to address that today? We excluded 2 sections, correct? We've addressed 1. So do I hear any motions?
I make a motion to address the second in such a way that a pharmacist in good standing with the Oklahoma Board of Pharmacy and knowledgeable in specialized functions of medical marijuana product preparation, dispensing, including the safety standards and quality assurance, be a dispensary manager at these facilities.
Second.
And that's found under the definitions in 681-1-4. And you're also suggesting, don't let me put words into your mouth, but there's a sentence at the end that says a dispensary manager may also be a licensed healthcare provider.
May or shall?
It says may. So if
There's
you're,
a line struck through it, at least in the, yeah, that's been stricken. So my motion, that would be stricken.
is everybody clear on the motion?
Yes.
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 Question clarification. Could this also be accomplished through contract arrangement? Because I know that's done in some places. A full-time versus contracting with a pharmacist to provide these services on an as-needed basis.
So currently your dispensary manager has to be on site
40 hours a week.
and actually dispense. So you're tying a pharmacist to be at the dispensary. It's my understanding, correct me if I'm wrong.
You're right.
And as I recall, Julie, in this matter, you felt it was, your legal opinion was that it was beyond the scope of the rules.
Correct. I think that this requires a statutory change in order to enact.
So Julie, for understanding, if we pass this rule as it's presented, and you're correct, and it requires a statute, what happens next?
Well, assuming that somebody challenges it, it would be challenged in district court, and there may or may not be a stay issued on either this provision or more. It just depends on what happens with the challenge.
Discussion?
I believe that many of the regulations we're discussing today are going to be challenged,
Amen.
no matter what.
Let's call for a vote, Diane.
Dr. Alexopoulos?
Aye.
Dr. Gerard?
Aye.
Dr. Graham?
Aye.
Dr. Krishnan?
Aye.
Dr. Legeko?
Nay.
Mr. Osterhout?
Aye.
Mrs. Payton? Aye. Mr. Skillings?
Aye.
Mr. Starkey?
Aye.
Motion passes.
So in this same manner, I would also like to ask Commissioner Bates to prepare a communication on behalf of the Board of Health to the legislature and governor outlining the policy gaps that we were not able to include in these emergency rules. The Board of Health has a responsibility to protect the public health of our citizens, and any policy considerations that have been discussed as part of this planning process should be shared with policymakers for future consideration. Thank you. Okay.